Which of the following best describes this patient's presentation? 20-year-old man presents a clinic with 3-month history of depressed mood, increased appetite, weight gain, excessive sleep. He also reports that his mood temporarily improves when he receives good news or spends time with friends, but then quickly returns to depressed state. Okay. How long? 3-month history. I'm thinking this either could be like dysthenia. I think the timeline for that would be like 6 months. If it cycles like this, if it goes on and off. That's why I might want to do major. I mean, he fits like the Siggy caps, I think, pretty well with depressed mood, increased appetite, weight gain, excessive sleep. That's only 4 though, but it's 3 months. So I was thinking, okay, major depressive disorder with atypical features, which is very common. So, and then it temporarily improves, but then he returns to the depressed state. So I like that. These ones are always funny because they're very definition heavy.
Sure.
And I don't think anyone is like perfect,
Okay.
but
Which one's your best answer?
I like major depressive disorder with atypical features because it's over that 2 weeks, and I don't think it's long enough for dysthenia.
Okay. Final answer.
Melancholic, yeah, final answer. I'm not sure what.
Yeah, so let's
Okay.
talk about this. Bipolar, right? You got to have ups and downs, and it's
Yes,
characterized by
manic
mania,
depressive state. Okay.
mania or hypomania, right? Dysthymia
Mhm.
is actually should be 2 years or more, actually.
Okay.
So at
But it's
least
similar, but the presentation is because it's like, oh, but then symptom free for a month. So it wouldn't be right after his friends be like, oh, he was okay for a month or two, and then he went back. Okay.
yeah. And then atypical features, as in, things like, for instance, right, characterized by mood reactivity, so increased
Hmm.
appetite or weight gain, hypersomnia, right,
Hmm.
latent paralysis, long-standing interpossession or rejective sensitivity. So these are things they call it atypical because, usually you can't sleep, right? These people are sleeping too much. Usually people don't eat when they're depressed, but these people eat too much, right? And so they're a
Okay.
little bit atypical, right? Melancholic fear, right, is loss of pleasure in all or almost all activities, lack of reactivity to usual pleasurable stimuli, and at least 3 of the following, and then kind of early morning waking, psychomotor retardation, right, anxiety, weight loss, things like that. Bipolar, we talked about. Dysthymia, it has to be two or more years, and it's usually just depressed mood. It's like it's like feeling sad and depressed mood, but not there at depression yet. Does it make sense? So it's
Okay.
like you're sadder mood than normal people that when they get sad, but not sad enough to be depressed, right?
So
But
they're so this thing they're functioning still? Like,
yeah, they can still be functioning. They can still be functioning.
okay.
And then it just lasts for over 2 years, right?
Okay.
And then seasonal affective is during the season, typically fall and winter, people get more depressed.
Yes. Hmm.